Traditionally, the as-needed or PRN medications for managing acute anxiety have been benzodiazepines, but these can be addictive and are often abused. They're also lethal in overdose. Sedation is their most common side effect, and they're associated with impaired cognition. These effects are especially concerning if patients are driving or in older patients who may be at an increased risk of falls. In patients with impaired respiratory function, such as chronic pulmonary obstructive disease or sleep apnea, benzodiazepines can cause respiratory suppression. So more recently, the aim has been to move away from the frequent prescription of these medications and replace them with agents originally designed for other purposes. The goal of these medications is to lower the fight or flight responses associated with anxiety and panic, so they all have potential side effects associated with suppression of the nervous system, such as sedation and dizziness. It's a good idea to advise patients to do a test dose with these medications to determine if they get drowsy and how long the effects will last. Hydroxyzine, originally developed as an allergy medication, also has anti-anxiety effects. Like over-the-counter diphenhydramine, hydroxyzine acts on histamine. Be aware that if a patient has had a paradoxical reaction to diphenhydramine, as some people experience agitation or hyperactivity, they may have a similar reaction to hydroxyzine. Medications originally developed to manage high blood pressure, such as propranolol, prazosin, and clonidine, are also used for the treatment of anxiety. These are particularly helpful if patients experience physical symptoms such as rapid heart rate, sweating, restlessness, and shakiness or tremors. Propranolol is particularly helpful for restlessness and tremors, and it tends to be less sedating. Prazosin is typically dosed as a bedtime medication, and it can potentially help with nightmares, such as those seen with post-traumatic stress disorder. If a patient tends to have low blood pressure or to get dizzy easily, these agents should not be used. Gabapentin is used for chronic pain, such as that caused by neuropathy or fibromyalgia, so it may be a particularly good choice in patients with those comorbid issues. Quetiapine is an atypical antipsychotic that is used off-label for anxiety and insomnia. This is a potent medication with a range of possible side effects, including increased blood sugar and lipids, so it's best reserved for severe cases of anxiety, only after other agents have been tried without success. Lastly, if you decide to prescribe a benzodiazepine, the following parameters are suggested. Prescribe the lowest dosage, establish a goal of short-term use, or use only for specific circumstances such as when flying. Create a patient contract establishing that the patient understands the risks and guidelines and agrees to follow the parameters you've laid out. And if available, use the prescription drug monitoring program in your jurisdiction to confirm that the patient is not obtaining similar prescriptions from other providers. It's recommended that the prescription of benzodiazepines is not part of routine practice, but rather saved for more severe cases, after ensuring that patients understand the risks associated with them.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.